My name is Dr. Masahiro Takakura. I'm the part of the Integrated Medicine group. We are a nonprofit group that provides the education community support and also to provide medical care on doing research. We want to do this video to start kind of sharing what we know in orthopedics, physical medicine, and in sports medicine. Today, first thing that we want to kind of talk about a concussion. I'm going to have two of my colleagues explain SCAP-5, how to do it. Number one thing about concussion is that do not assume the patient is okay if they're talking to you. Always assume that there's something's happening. So make sure to go through the SCAP-5 thoroughly and make sure to rule out the red flag. Red flag will be could be hematoma, hemorrhage, intracranial, epidural or subdural hematoma could be, and it can take up to like a week sometimes to develop that. So we need to really do thorough screening and make sure that your athletes, patients are safe.
All right, so I'm going to be talking about the SCAP-5, which assesses for concussion, so the Sport Concussion Assessment tool. You'll notice on the first page, this would be the first assessments you would do if you're finding a athlete on the field. If the athlete is coming to you, then you would skip this page and go on to the next page. And so this would be ruling out, again, if you're finding the athlete on the field, you would rule out red flags, notate observable signs, do a memory assessment, and the Glasgow Coma Scale, and a cervical spine assessment. If the athlete comes to you, you would just move on to the next page, skip the first page, and get the athlete's background, ask about their history, like if they've ever been hospitalized for a head injury, then move on to the symptom evaluation, or step 2. The athlete would actually read this section and then go through the different symptoms and rate if they're currently feeling the symptoms at all, or if they're mild, moderate, or severe. So the scoring for this one is if it's a higher score, then it's a worse symptom presentation. Next would be going into the cognitive screening. So that would be evaluating for orientation. So for example, what month is it, what is the date today, and so on. Next is going on to immediate memory. So there are a list of 5 words. There's a list of 5 words or a word list of 10 words. You could just do the 5-word list, and you would pick one of the lists. So there's columns A, B, C, D, E, or F. Just pick one of them, and you would read off the list of the 5 words and have the athlete repeat that list in the same order, and they would repeat that for three trials. And each of those trials would be a score. So there's 5 words. Each of those would be a score of 5, and you would score it for the number of words that they got correctly, and so the total score would be out of 15. Then moving on to recall for digits, you would pick one of the lists. So there's 6 options, A through F, and you would go down the list. It starts with 3 numbers and then increases up to 6 numbers, and the athlete would read it in the reverse direction. Like, so I would say 1, 4, 2, and wait, no, it's just in the same order. So 1, 4, 2, and they would repeat the digits back, and you would score it whether they got that correct or not. The list that's in the reverse order are the months. So the athlete would, off the top of their head, go through the months in reverse order. Next
Dr. Melissa, I do think they're reading the numbers in reverse.
They are reading?
Mm-hmm.
You repeat them back to me. Okay, that's right. Okay, so excuse me, that was my error. So it would be reading the numbers, so 1, 4, 2, and then asking the athlete to repeat them back in reverse order. So 2, 4, 1 for that example of. Okay, so then next is going on to the neurological screen. Okay, so the next section is the concentration section, or digits backwards. So you'll see that there are 6 lists of digits, and as you go down the list, there's more digits added. So you'll read, as the practitioner, you'll read the list of digits in the order that they're shown on the page, and then the athlete will repeat them back to you in the reverse order. So for example, 142, athlete would say 241. There are, with the same number of digits, there are 2 of those each time. So for example, there are 2 times that there are 3 digits, 2 times there are 4 digits, and so on. And so the scoring is such that they would need to get at least, so like 142, 241, they would get that correct, and say they got this other one incorrect. Because they got at least one of the string of 3 digits correct, they would still get a score of 1. They would have to get both of them incorrect to get a score of 0. Okay, and then from the next section would be the months in reverse order. So the athlete would be asked to name off the months in reverse order. Next is the step 4 is the neurological screen. So when the patient was reading off the symptom checklist, when they were rating whether they had that current symptom and if it was mild, moderate, or severe, were they able to do that without difficulty? Then you would assess the athlete's full range of motion of the cervical spine and passive. And you could do that with the athlete seated, but as a practitioner, you would guide the athlete's head. And then you just continue on. So moving, are you able to move their head and neck? Or no, excuse me, is the athlete able to move the eyes side to side, up and down without moving their head and neck and without double vision? Can they do the finger nose coordination test and walk in a tandem gait? So toes to heel, walking in a tandem fashion. Next would be the balance exam. So the first of that balance exam is the double leg stance. So athlete would stand with both feet together as such, with the eyes closed for 20 seconds. Next is single leg stance. So they would stand on the non-dominant foot, raise the dominant foot, eyes closed, balance for 20 seconds, and then tandem stance, non-dominant foot back behind the other foot, eyes closed, and try to hold that for 20 seconds. And you would note the number of errors, and that's rated out of 10, total score is out of 30. Okay, so then we end with step 5, the delayed recall. So the series of 5 words that were asked earlier in the examination, ask them to repeat that and see how they're able, how their delayed recall is of that sequence of 5 words. And then you'll move on to the scoring, and I'll let Dr. Devin take it away from here.
All right, the last section of the SCAT 5 is the decision making. So this is where you're going to be scoring the athletes' scores for the SCAT 5, and you're going to have, just to note, like each one is independent of each other, so you're not going to be adding these up. Each one is scored independently, and then you'll make a decision based off of each of those. So for the symptom number and symptom severity score, the higher the score is going to be the poorer that the athlete did. And then for the orientation, immediate memory, and concentration, the higher score is going to be a better score. And then for the neuro exam, balance, the higher score is going to be poorer. And then for the delayed recall, the higher score is going to be better. So you're just going to be going back to the SCAT 5 and adding up each of the players' scores, and then you're going to make a decision based off of that. And then this is important because you're going to be using this for tracking the athlete's follow-up during future returns. So just some common mistakes that we have found over the years using the SCAT 5. I'm just going to kind of review some of these. For the baseline test, a lot of the things that we do for some of the events, like the volleyball, is it the Seattle or the Emerald City Volleyball Tournament or the Seattle City Marathon, we're going to be seeing athletes where we haven't assessed them prior, but it's just important to note, like if you are working with a sports team or you are, you have patients that you know are involved in athletics, it would be good to kind of start with a baseline, just so when they do come in, you can compare to see kind of the severity of their possible concussion. But a lot of the things that we do, like I said, we will be skipping the baseline assessment. For the eval, we just want to emphasize for step 2 of the symptom evaluation, we just want to make sure that the athlete is reading that out loud, and then they're filling out this score by themselves. The rest of the exam is going to be the practitioner filling it out. And then let's see, so for the cognitive screening, we want to, so for the immediate memory, for each trial and each round, for each trial that it says on there, the practitioner is going to be repeating the line back to the athlete. So I'll say to Dr. Melissa, candle, paper, sugar, sandwich, wagon. Dr. Melissa would repeat that back, and then that would be trial 1. And then for trial 2, I would repeat that again. So then I would say again, candle, paper, sandwich, candle, paper, sugar, sandwich, wagon. And then Dr. Melissa would repeat that again, and that would be trial 2. And just something to note, a lot of times, like when we're going through this, athletes will kind of get kind of antsy. They kind of want to get back on the field, especially if it's a possible mild concussion. But it is something good to just note, to kind of reinforce, like, we got to go through this, and we should be dedicating at least like a minimum of 10 minutes, because we're going to be doing the athlete disservice if we're cutting that short or not going through this full assessment. But a lot of athletes, you can understand, like, they want to get back on the field, especially if they're feeling, okay. But athletes have a good, ability to kind of reduce their symptoms and, have a high pain tolerance, a lot of them. So it's just something to note, like, we got to educate them that this is important, and it'll take at least 10 minutes. But then with this evaluation, we can make a good decision, so there isn't any adverse health outcomes. So we just want to really emphasize that. For the balance test that Dr. Melissa showed earlier, we want to make sure that the athlete has no ankle tape on, because that can impact their balance as well. And we want to make sure that their eyes are closed and have their hands on the hips. And I think those are the main things that we've seen in the past that have impacted this SCAT-5. So thanks.